I'm doing this talk on my own today. If you enjoy it, please remember my name, Tegwyn Williams, but if you don't, I'm Emma Clark. Just thought we get that out of the way. So, I'm a psychiatrist who works in the Burwood Day Hospital, which is a unique New Zealand clinic which provides care for people with complex problems that often include physical health issues. So we see people with Parkinson's, less so with multiple sclerosis, but we do see people with lots of complicated physical health. So I have some experience in how that interacts. Now, for me, it would help if you can, rather than I ask you at the end of every slide, I'm sorry to make you feel a bit like a primary school, but if you have a question, stick your hand up and I'll stop, rather than asking you. Is that okay? Right, so, I've asked to talk about aging and old and mental health. Well, most of us in this room, me included, will realise that growing old is not for sissies. It is hard work as we get older, because as we get older, things wear out and things fall off, right? And that's without any other health issues. So what goes wrong? Well, unfortunately, I've been told I've got to make sure that I don't get out of the camera angle, so my walking's a bit stilted, that's the reason. So, what we have is every system is affected. But I'm talking to people, I'm looking out at the audience, I see other proud gold card carriers, and they will know these much better than any textbook. Right, your muscles get less. You no longer can do what you wanted to do. You know, in my house now, every movement I make comes with a sound effect. Right? And I'm sure you understand that. Your skin is no longer nice and tight and attractive. Your hair falls out, you go grey, you can't see things, you can't hear things, and things begin all to taste like cotton wool. It really is not good growing old. And then that's only the bits you can see. Inside you, everything is wearing out. Your kidneys don't function as well. Your heart doesn't function as well. That's why you get more breathless running up and down stairs and things like that. And what we're really interested in here is your brain fades as well. I'm looking around, there's probably only one person in this room whose brain is at peak function. From the age of 24, it's downhill, right? It shrinks, the electricity moves slower. Now, luckily, our brains have so much redundancy, that is so much more capacity than we ever use, that for most people isn't a problem. But it does mean, as you get older, there is less capacity to switch subjects, there's less capacity to problem solve, and we're not as sharp as we once were. Except for me. Right? Because we all actually don't notice a lot of these things. So, I was asked to give some tips on aging well, right? And one of the Burwood Hospital, the day clinic's mottos is, grow old disgracefully. Because actually, that is probably the best advice I can give any of you. Have fun as much as possible, regardless of who you are, what you are, whatever, because actually fun is healing to the brain if you are enjoying things. So, have fun. Do what you can when you can, because that's important. It preserves autonomy. It preserves your sense of self, because often what we do is who we are. Right? Concentrate on what you can do, not on what you can't. Right? I can no longer play outside half for Wales and rip the English defence to pieces while scoring the try to win the Six Nations. You right?
Nobody can.
We will argue later. Being a proud Welshman, I can debate that till the cows come home. But The actually is none of us can do the things we could do. That sucks, but it's true. But I can still do lots of other things. I can still hurl abuse at referees, being the best rugby coach in the world. So that's how I do the things I can, and I enjoy them. Now, I don't expect everybody else will have the same interests as me, but that's what's important. I don't concentrate on what I can't do, I enjoy what I can. Plants can teach you a lot. Adapt and grow in the right direction. Keep developing things, develop interests, things you can do, right? They are important. And don't sweat the small stuff. You know, there's an old cooking phrase, life is too short to stuff a mushroom. Bear that in mind.
Oh no, I've got a good recipe for that.
Talk to you later. Yeah. But you get what I'm saying. You know, you want to stuff a mushroom, fine, but don't sweat the small stuff. And the big stuff is so scary to us as we go older. Because whether we like it or not, we've come round the final bend and, you know, the end is in sight. Now, it doesn't mean it's tomorrow, but when we are 20, we are indestructible and we will live forever. When we're 65 and 70, less so. You know, we ain't getting out of the car and we know that there's more behind us than in front of us. But the thing to remember is you've still got a lot of control, and that makes you feel bad. Education, you know, making your wills, making your advanced care plans. Don't spend your time worrying about the big stuff, plan for it. And if you can manage a lot of those, they will help you age disgracefully. So, if you look at that, I'll have to come over here so I can see what I've written, is things are important. Feeling low, forgetting things, are not necessarily part of getting older. Right? They can be to an extent. You know, who here hasn't got into a room and forgotten what they're going for? To the men or husbands in this room, I can give you some advice from my own personal learning, that actually, if that happens to you, tidy something up. Because if you do that, one, it's meaningful, you've got in there, and two, you get brownie points with the boss. Right? Worth remembering, because it happens to us all. There are a lot of mental health issues in old age, some of them more likely in old age, depression, dementia, anxiety. They are common, but they're not inevitable. And the trick is, and we'll talk a bit about that, to know the difference between when it's a problem that you need help with and when it's just a bad day. Also, with interventions, treatments of various kinds, things like that, all these problems can be relieved or managed. You're not in it alone, and that's again an important thing. So, when we get older, losses are important. Now, I'm talking about these, and the next slide points out, for those of you with chronic neurological illnesses, you know, they do a lot of these as well. So, sadly, you've got a double whammy of bad luck. But, just think about it, just normal aging, you lose your mobility, you lose your dexterity, you can't do the things you used to. And for some people, that's a huge loss. I deal with patients who used to get all their pleasure by running marathons. And now, you know, they hit a certain age and their knees go. And where do they get the same amount of endorphins and satisfaction doing it then? One of my patients held the New Zealand 100-kilometre record for running. You know, to me, that's an Uber journey. You know, but he seemed to think that, you know, running this was fun. Yeah, that's what I thought the mental health problem existed, but he had a different view. Anyway, the social loss. We lose things that are really important to us. And we all have roles in our lives. We see ourselves as a mother, a wife, a lawyer, me, I'm a doctor, all these kind of things. And when you no longer can do that, that can be very challenging to your sense of identity. So, I'm going to make a gross generalization now, so please don't worry. But actually, some of that is easier for women than for men, because women often have multiple roles. You know, they are the mother, they are the housemaker, they can hold down a job, etc. Whereas men, better or worse, we often invest more in just our work. And therefore, when we retire, or when you can no longer work, your whole identity goes. Important thing to think about. Psychological things. Well, there's two psychological problems.
Which of those three is the most important as a loss?
Right. We'll come on to talk about that. There is no right or wrong way. There is your way. Some people actually aren't worried if they can no longer run a marathon. Some people, it's their whole sense of identity. Some people, you know, being a mother, being a carer is the most important thing, and then when the kids fly the nest, they don't know how to function. Some people, you know, it's the work. It varies for an individual. I don't think there is a, you know, one matters and the rest don't. But looking at it as an individual with those things, you can work out your own, you know, I haven't lost much of this, but I've lost a lot of that. Yeah, does that make sense? Everybody's will have more of one than the other. And I think the psychological losses, and I'm not so, we can talk a bit about, some of those are organic, the chemicals in your brain, things like that of which you've got no control. But some of them are, you know, you lose confidence. You can no longer do what you could, you know. Therefore, you know, you used to walk around, now you're worried. You know, you've got to be never more than 10 steps from a toilet. Whatever it is, as you grow older, you know, that makes you very loss of confidence, makes you very anxious, very distressed. And then there's the other things that are sort of less, I call them invisible losses. And they must affect people like with your kind of problems. Or you can't just decide, oh, let's go X. You know, it's like when you have small children, you know, you can't just spontaneity goes. You've got to have a plan. It's like planning a military operation sometimes to get everything organised. So spontaneity goes, and spontaneity is associated with fun. Privacy. You know, when we become older, people don't see us quite the same way. Either, usually don't see us full stop. Right, so what I'm saying is that you have all those problems and you can have, they build on the issues that Parkinson's disease and MS affect you, because both of those, being enough for themselves, can affect how you think, feel, act. So you've got, as I said, the double whammy. But, you know, I'm sitting here, or standing here being a, you know, this is all doom and gloom. It isn't actually. I never cease to be amazed at people's resilience. You know, the people that can laugh, the people with a sense of humour, the people that cope remarkably well and are strong in spite of adversity. You know, give yourselves credit for that. Right, now coming on to, for me, which is the difficult bit, which is trying to work out when a person is sitting in front of me or at the clinic, what's causing the problems, because the same symptom can be caused by many things. For example, depression, anxiety and cognitive problems are common in people with Parkinson's disease and MS. Not because of the way those diseases affect the brain. People with Parkinson's disease can see distressing things that upset them that aren't there. You know, is that the Parkinson's disease or is that mental illness? Fatigue. Now, I've got a slide about this, which, you know, fatigue, slowness, difficulty motivating yourself is common in depression, but it's also common in Parkinson's disease and MS. And you know, what my depressed patients worry about is that people will think they're lazy. When actually, they're not lazy, they just can't do it. But when you've been a doer, and now you can't do it, you think people will judge you. Parkinson and MS, I mean, again, I'm talking to the converted, affects your sleep. And we all know, you know, even those of us who are lucky enough not to have a disease, if we have a couple of nights without sleep, we become more grumpy, we become more stressed out, we function less. And also we know that even simple things like a toothache are more difficult to deal with if you haven't had a couple of nights sleep. You know, so again, interplay between something that could be a symptom of a mental illness, sleep and appetite, are things we look for, or a physical illness. We know thinking slows down, attention and concentration, memory problems, reduced ability to multitask. All these go along with chronic neurological conditions, but also occur in mental illnesses. And so, sadly, just because you have a chronic neurological condition doesn't mean you don't get mentally ill. They don't, and just because you don't get mentally ill doesn't mean you don't get a chronic neurological condition. So the symptoms that we're seeing could be caused by either. So, symptoms that they can be misunderstood. Slowed down movement, Parkinson's disease, neurological, depressive slowness. Someone who's very depressed has difficulty moving around. They slow down. Fatigue, low mood, sometimes interpreted as laziness. Reduced facial expression is common in depression. We say it's lack of reactivity. In Parkinson's disease, it's a mask-like face that doctors describe it as. Exactly the same look. From the other side of the room, you can't tell. Cognitive slowing, dementia, depression, anxiety and tremor. It gets written off as someone's got Parkinson's, so the tremor's got worse, therefore obviously the Parkinson's got worse, when actually it's something else entirely. So a bit of talk about depression. Now, we all have bad days. Now, I love my job, but there are days I could walk out, throw a firebomb over my shoulder and not look back, right? We all have a bad day. And people living with chronic illnesses, I understand very easily how they occasionally have days when it all seems too much. That's normal. But depression is a pervasive sense of that. And the way I describe it is the difference between the weather and the climate. We know, for example, the winter is colder. But during that, you can have an odd sunny day that's warm and nice. Doesn't alter the fact that the winter season is cold, but you have the odd day that's different. Or you can have it the other way in the summer. It's very nice, but you can have the odd day, especially in Christchurch where it rains and pours and is cold. So, you know, depression is the climate. It's there all the time. Yeah, you can have an occasional good day, but it's there all the time. Just a normal, when you're feeling yourself, but you have a couple of bad days, don't beat yourself up. It's okay. You're not ill. Dementia, what's that? Well, that's again something that is slow and comes on over years, and you don't wake up with dementia. You often don't realise it if it happens to you, your family and carers do, but it's about forgetting things. It's about telling the same joke over and over and over and not just being a bad dad, right? You know, it's about getting confused about where you are, who people are. As I said, these are the similarities. You know, so not only does physical illness cause these symptoms, but depression and dementia also cause the same symptoms. So as you can understand, it's difficult for anybody, including the person suffering, to work out what is going on. So poor concentration, sleep issues, reduced motivation, cognitive impairment, apathy and anxiety can all be caused by anything. And that's why when people like me are assessing it, a history is important. Listening to relatives is important. Because when I'm looking at it, as opposed to looking at it through a long term, but looking at it just on the day in the consulting room, it could be anything. Anxiety. People often ask me about anxiety. Again, anxiety is good. Anxiety is there to get your body into what they call flight and fight mode. Yeah? If you're in a room and they throw in a tiger, you're going to be anxious, and that's going to give you more muscle power and more energy and enable you to get out of that room easier. That's why anxiety exists. Being anxious before exams, perfectly normal. Being anxious because you've got a doctor's appointment, perfectly normal. But if that anxiety becomes less attached to triggers, like it's just anxiety. If it is disproportionate, like you get totally incapacitated about being asked whether it's tea or coffee you want, then it affects your life, then it can become what we call an illness. Now, it usually goes along with depression. Depression and anxiety are two sides of the same coin. It's basically the same illness. Some present more with depressive symptoms, but they're a little bit anxious. Some people are very anxious to have a little bit of depressive symptoms, which is why the treatments are very similar. But it's when they start overshadowing your life, that's when the problems occur. So what should we look out for when we're trying to work out, is it just a bad day, or is it something that I should talk to my doctors about? It's timescale. A big clue is withdrawing from something you used to like. If you liked going to meet your friends for a cup of tea or coffee, and you stop doing that. If you begin more totally helpless all the time, get fixated on death and dying. These are all kind of things. But the classic ones that doctors look out for are persistent differences of sleep and appetite. The appetite, some people comfort eat, some people can't be bothered to eat. Some people can't sleep, they have difficulty getting up and they wake up feeling really bad in the mornings. Some people, actually just go to bed and sleep. But it's a change that we look for. Well, some people sleep more than other people all the time. So these are the kind of things that make you think that actually there is an illness going on that we can help with. The other thing is carers have higher levels of depression than people suffering with illness. And this doesn't matter whatever the illness, whether it's a neurological illness or a mental illness or dementia, carers is a strain. Again, I feel a bit of a fraud saying this because I talk the talk, you walk the walk, right? But it's there. And there are things that make it more likely that a carer will become depressed. If the person they're caring for is a younger, fit male, because they don't cope particularly well, and therefore the carer has to look in. certain things that affect behaviour, Lewy body, Parkinson's disease, frontotemporal dementia, again neurological conditions that are difficult to manage. Carers, a wife finds it more difficult to cope with, maybe because she's more emotionally engaged. And cultural factors, what other things are going on in a person's life if they've got lots of other demands on their time. Yeah?
So, what's Lewy body mean, please?
Right, I was coming on to talk about it because someone's asked a question about what Lewy body disease and Parkinson's disease. I understand you're going to have a long talk about it because the answer is either very simple or a whole long lecture. Lewy body disease and Parkinson's disease are incredibly similar and thought of as being caused by the same process. If you go and see a psychiatrist first because is presented with emotional problems, you get labelled as having Lewy body disease. If you go to see a neurologist first, you tend to be labelled as having Parkinson's disease. Caused by a breakdown in a certain area of the brain that results in the tremor and things like that, and the stiffness and the slowness of movement, but also causes hallucinations, memory problems. So they're part of the same illness. So what helps? And it helps both a carer and someone who's has understandable reasons to be miserable. Finding what works for you is the key, and this is why it's sometimes very difficult for people, I mean, because there is no one size fits all. Everybody's journey with illness and recovery and ongoing health issues is different from everybody else's. And so you need to think about what makes your life better. Don't let anybody else tell you. You know better than everybody else. Things we know generally that help: exercise and socialization. Now, I work a lot with people with the early stages of dementia, and there's a lot of talk about these drugs that we can use to help with dementia that actually have, sometimes it's difficult to prove one way or the other whether they have any benefit or not. The jury's still out. What I can tell you is that if you exercise for between 10 and 20 minutes a day, and I'm talking gentle exercise, go for a walk, and keep social contact up, you can reduce your dementia risk by 30%. Brain health, if you do those two things, you keep your brain healthier than anything us clever doctors can do. And if I could write a prescription for that, everybody would think I was a genius because I'd be getting so much better results than other people. It sounds so simple, but it's difficult. I mean, since I did that, I looked it up one day. I thought, okay, so I went out the next day and bought myself an exercise bike. So I think I'll do my 20 minutes. 30%, that's a third of the reduction of the risk or slowing down how your brain is deteriorating can be done by you taking control of your illness, doing a bit of exercise, and going out and meeting your mates for coffee. Much more than I can do. If I use my fancy drugs, I can reduce it a tiny little bit. You can do a huge amount. Bear that in mind. Non-specific ways of reducing your stress. That's why places like Braintree are so vital. Education, understanding what the problem is, puts you more in control of it, or if not in control of it, having an understanding of it, and it becomes less frightening. Leisure activities, again, back to my big thing, have fun. Find something to do that you can enjoy. And yes, we are all getting more and more limited, and people with neurological difficulties get more and more limited in what they can do, but you can always find something to do. support. That's again why places like Braintree are so fantastic, because rather than just having people like me who can talk the back legs off a donkey, I can, but I can't walk the walk. I've not done it. And from personal experience and talking to patients, talking with people who've actually lived through it and are living through it is incredibly supportive and helpful. I think places like Braintree do probably more good than us doctors do. We might pretend to be clever and have lots of fancy machines, but actually this kind of education, this socialisation of things, has far more beneficial effects to people. Mindfulness. Do you learn mindfulness? Do you know what mindfulness is? Yeah. It's something that has got very trendy and been sort of labelled by psychologists. It's actually been around for thousands of years. It's about Buddhist philosophy. It's about meditation. What it is that if you're worrying about something and you do something that takes a lot of concentration and you empty your mind, you can't worry about whatever's going through your head. So you learn tricks. Now the real one that a lot of people get told about, and some people drive them up the wall, is adult colouring in books. Anybody use those? Yeah, they're really good, because actually you have to concentrate the best you can to keep it within the line. Or it's the same if you count, 10 red things in the room or whatever it is. You're concentrating. If you're concentrating on that, you can't be worrying. Jigsaws, all sorts of things that require concentration. Computer games, surprisingly, are very good, because when I'm busy there shooting monsters and battling my way across mountainous ranges, I'm not worried about work. I'm more worried about if there's an ogre behind that rock and it's going to attack me. It sounds silly, but it helps. Right? I mean, it does sound silly, but that's what I do for mindfulness. I go and battle monsters. My wife thinks I'm crazy, but it really helps me.
What part would playing card games?
Exactly the same. I mean, yes, exactly. If you can still play bridge, something like that, where you've got to think. Mahjong's good, because the order in which you move the tiles makes a big difference. Again, please don't all go away and buy computer games and hurl abuse at referees. These are my answers. I'm just giving you examples. You've got to find what works for you.
What works for me is doing a new recipe every 2 days, where I have to concentrate on getting the right ingredients and following the instructions, and everything else goes out of my mind.
That's an exactly brilliant thing. You found something that you're interested in, is actually good for you, because it keeps you eating and diet and interest. And you're right, you've got to concentrate, so the other things for an hour, 2 hours, are not a problem to you. And we all, even if it's just an hour or two time off in our heads, that's worth having. Right? Counselling. I'm not sure what what it means is talking to a professional, and that professional, they're going to hate me, but it doesn't actually matter what training they are. It's someone who listens, someone who empathises, someone who supports you. It doesn't matter whether they're a nurse, an occupational therapist, even the barista making your coffee. That's all counselling. Treatments, this is my bit, but as you notice, again, I avoid medication as much as possible. Because psychiatric medication, like all medication, you know more than I, is a double-edged sword. For every advantage, there's a disadvantage, a side effect. So if you can do it without medication, it's better for you. And everybody's different in their responses to medications and treatments. So again, you've got to tailor your treatment to you. Talking therapies. We can help people think about things differently. That's different from counselling. That is psychological intervention. Now, a lot of people think, how can you teach me to think differently? But you can teach people to think like you can with any exercise. If you practice it, your skills, and then you consciously do it, and then you unconsciously do it. Those people, you know, muscle memory, we all know what it is. We don't think about walking. We don't think about, you know, grabbing a... Thinking can be the same. Muscle memory, it's the same sort of thing. You can be taught to think differently. Keeping socially connected and gentle exercise. Medication, when we get older, our biggest risk is actually a fall, right? Regardless of any horrible diseases that we have, and I mean heart attacks, cancer, you know, MS, Parkinson's disease, our biggest risk is a fall. Because falls have an incredibly high mortality. And therefore, a lot of my medication that I give people can increase falls risk. So you've got to be careful about using them. They save lives, certainly they do on occasions, but they're not happy pills. If I give you an antidepressant, you won't feel better tomorrow. You actually may feel worse because you get side effects like a dry mouth or something like that, and they take 3 weeks to work. So they're not happy pills. And if you've got a problem with your blood pressure when you stand up, they can make that worse, which can increase your falls risk. So, very useful drugs. I use them all the time, but don't think they're the answer to everything. And if you can do the other stuff and it helps, do the other stuff.
Can I just ask you? Oh, sorry.
I've got noise on.
Can I just ask you about the low sodium you've got written there?
Yeah, well, that's interestingly one of the things that happens with these drugs. With older people, not with younger people, it can drop your sodium. And what low sodium can do, if it's bad, you know, just dropped it up, can make you very confused. And if you become very confused, you're more likely to fall. If you are very confused, being confused usually isn't fun. Sometimes I've seen people who are actually quite amused by what's going on for them. But most of the time it's quite scary, it's not pleasant, it's terrible, which is why when we start people on antidepressants, we often measure the sodium for a bit. If it is dropping, it's not difficult to treat. My treatment option is usually I tell people to eat a bag of chips a day. Because salt tablets, yeah, okay. I go to the supermarket, I can buy that much salt for a few dollars. Salt tablets are not, you've got to buy them yourself, and they cost something like $50 for a month or something. They're ridiculous. A bag of chips is cheaper, tastes better, and makes you feel slightly naughty. So it's good for your health.
So with like I have low blood pressure and MS, and so if I have more salt, does that increase my blood pressure?
Right.
Is that?
Unfortunately,
it's off task.
No, it's not. And the reason I'm hesitating because I'm going to give you a typical psychiatrist answer, which is yes and no. Okay? In theory, it can increase your blood pressure, and that's why they say have a low salt diet.
If you have high blood pressure.
If you've got a high blood pressure.
Okay.
Yeah, I mean, it actually doesn't make that much difference.
Okay.
But that's often what they tell you. But sometimes if people's blood pressure drops when they stand up, why that is because when we are younger, we have fit legs, right? And that when you stand up, gravity will tell you that your blood will pool in your legs. And when you're younger and fitter, the muscles in your legs contract and it pumps the blood back up to your ass. It gets to the brain, you don't feel dizzy. When we're older, that doesn't work so well. And when you have MS or when you have Parkinson's disease, that doesn't work so well. And what happens is you stand up and blood doesn't get to your brain and therefore you fall over. That can be helped by increasing the salt in the diet if you've got a low sodium. Now, if you haven't got low sodium, no, it doesn't help. Okay. And you can't tell whether you've got low sodium or not. It doesn't make you feel any different.
Thank you.
Sorry,
I'll come to you in a minute, yeah.
Sorry. Also, on the treatment thing, I would suggest that the old age layer is like arthritis and the pain associated with that, like, and if we're taking anti-inflammatories, I'll just take paracetamol. And so by taking those treatments, you actually feel better. So you feel
Of course you do.
Yeah, yeah. And it's
Okay, I was
sorry,
about...
it's just, no, I'm not, yeah, I know you're talking about...
No. I mean, the one thing I didn't mention in all my poem, thank you for telling me, is pain. Chronic pain is very depressing. We all know that, whether it's a toothache or something more serious. Of course it's depressing. And paracetamol can help. The reason I'm again doing my psychiatric face is because what they're beginning to realise is anti-inflammatories can help mental illness of themselves. That maybe some depressions and some of the more serious illnesses like schizophrenia have an inflammatory basis. And I've certainly had a patient that I had been treated with every antipsychotic she'd been in hospital for years, every antipsychotic. I thought she was just having more side effects, we weren't getting anywhere, so I stopped it, put her on regular paracetamol, and she got better, and nobody could explain why. Right? Now that doesn't affect everybody, but that's what I'm saying is, everybody's depression, everybody's schizophrenia, everybody's anxiety is different. And sometimes if the standard treatments don't work, try something different. And paracetamol, and it wasn't because she didn't have any pain, it actually affected what was going on in her brain. How? I don't know.
What effect would alcohol in the form of beer and spirits be on a person's medication?
Right. Again, I'm such a typical psychiatrist. I can't give a straight answer to a straight question. Right. We all know that alcohol disinhibits us and makes us sleepy. Right? That's what it does. That's sometimes why we like taking it. Some medication we have makes us more sleepy, so you get a little label on it saying, don't drive heavy machinery or something about that. On the other hand, I firmly believe, and I probably will be drummed out of the doctors' union, that the odd glass of wine or the odd beer, if you enjoy it, is far better for your mental health. Not medically, I'm not going to argue whether it's good for your health or not, good for your mental health. If you really, like when you go out for a meal with your family to have a glass of wine, if you're going to a wedding and you want to toast someone in champagne but you feel you're on medication, forget it. Take the alcohol, right? However, don't drink too much, because as we get older, again speaking from personal experience, when I was a young man, I could go to rugby internationals, get up the next day, go to work. Nowadays, if I go to a rugby international, it's 2 days off recovery. Yeah?
Another eventual loss.
Yeah. But, those are because we're growing old. That's not a medical thing. So, the odd drink will do nobody any harm. It won't do you any good a physical doctor will tell you it's not good for your health. I will tell you as a psychiatrist, if it makes you feel good or makes you feel a bit naughty and a bit delinquent, go for it. So, aging and mental health is difficult, but actually people cope with it. People have been fortunately getting old since time began, and most people cope with it, right? Small gains matter. Take your wins where you can. Quality of life is more than just being able to run marathons. Yeah? It's having people around you who love you, having things that you care about, having your dog come and have unconditional love, whatever it is. Support, treatment and understanding make a real difference. So, mental health, this is my sort of take-home line. It's not weakness if you are becoming depressed or anxious or something about that. It's part of the territory. And again, by acknowledging that, you can manage it and it becomes less scary. So, that's aging, mental health and chronic neurological disease in 45 minutes. Sorry it was a bit of skating over the surface. I hope that's it. Open to questions.
Thank you. So we did have a few sent in to us, so we'll go through those. Hopefully some of you got your questions in already, but we'll give a bit of time for more questions. And I really just wanted to acknowledge before that this whole holistic focus, I know we go on about it so much within Braintree, but it's been really refreshing to have that acknowledged, that it's not kind of the one fix, it's all those things, and it's looking at really what is important to you, and it being very personally values driven. So your values will differ amongst the room, each and every one of you, and it's working out what is it that kind of really drives me, and how can I still maintain that in some way, in some form. It may look a bit different than it once did, but how can we get the essence of that? And I really think, that really spoke to that today. Yeah. So thank you so much.
It's the truth.
So one of the questions we had come in were, is there any education for health professionals dealing with challenging behaviours in the community?
I'm sure there are. I mean, I am not an expert in that, in what's going on in the community, but I'm sure there are. I just don't have any off the top of my head, I'm sorry.
Yeah, I think for, so there's lots going on in Braintree that people can tap into, so different talks throughout the year, but also Merck is a good resource online, so the mental health education resource, which is online. They do have some courses, but I think we spoke about this before. It's just important to understand what the behaviour is you're talking about, because that can be so vastly different, and then approaching the correct team to work alongside you to ensure that you've got the support for that.
And my only thing is, if there is a concern to a professional, take it up with your manager. It's their job to find you the training you feel that you need to do your job. Whereas I don't think, I mean, I can talk to you about management of challenging behaviour, but that's not the same as professional training, you know. Because most behaviour is driven by anxiety, pain, frustration, and you've got to understand what's going on before. There's no global, again, no global answer to anything. Okay,
we had a question on dealing with back pain. I think that was for Emma, because her bio said she came from pain management, but did you have anything to...
Move as much as you can, don't rely on medication, and don't boom and bust. Probably be well. I mean, I'm not an OT, you can do that better than me, but I think that the danger is we rely on medication, we don't exercise, and that just makes the pain worse.
And on the good days, you try and do too much.
Yeah, so that's the boom bust side.
The boom and bust thing is, I mean, and I'm the same. I mean, we all are. I'm having great today, so I'll go out, dig the garden, I'll do the painting, and then I'm incapacitated for 2 days. Whereas if I just did one of the 3 things, pace yourself, don't knacker yourself, for a non-medical phrase.
We are looking to have a pain talk, so that's coming. So if not already included, you have talked a little bit to this, but please can you talk about living with the fear of dying? It's inevitable, but how do you accept it and not worry about it?
Oh boy.
That's a little question.
Yes. But, right, it's an existential human question, and I would start by saying all of us live with that at some level or other. And it was a bit about my talk about how difficult it is when we're coming around the final bend, and the final bend occurs at different times for all of us. But I was once told by someone was the best defence is living well, and that is how I would recommend it. You know, try and live the best life you can, because you may be hit by a bus tomorrow. And if you hold on to that, which I've now started to do, actually, that helps. I mean, but I think people come to acceptance through various routes, some of it through religion, some of it through help, some of it through time. It's another journey. I've got no answer to that, I'm afraid. I wish I did.
And acceptance isn't a linear journey either.
No, it
can
isn't.
look a bit like this, and yeah.
And you will always still have bad days. That's okay. You've got a reason to have the odd bad day. If you want to have a day where you're just grumpy, enjoy it. No, I'm being serious. Don't sweat the small stuff. You're having a bad day, be a grumpy old man or a grumpy old woman, but play it to the best you can.
Yes, I think a part that could be played would be feeling positive about what you achieved.
Yeah, absolutely. I mean, you know, and also little things, you know. I have to be more proud of less than when I was younger. I can no longer carry the same amount of weight, but I can still do something. I can still do some things in the house. I can't, you know, well, let's say I think I can, but my wife doesn't think I can go up high ladders anymore.
I was told at one stage that when you get up in the morning and you find that you're alive, get on with it.
Absolutely. If you get home in one piece, it's a good day. Absolutely. Yeah.
Okay, so the next question, again, we have touched on this, but if you wanted to talk to it more, do you have helpful tips for someone with Parkinson's who sometimes feels overwhelmed by how different life is now, and how hard it is to be positive some days?
Again, that goes back to what I do. You have, if it's for an odd day, roll with it. If not, you start by thinking about what you can do, what you can't do. Dwelling in the past is difficult for all of us, whether or not you have Parkinson's disease. And that's hopefully one of the messages I've given you. And I know I don't carry anywhere near the weight you carry. But none of us can do what we used to do. And everybody grieves for the young person who was indestructible and was going to live forever. You'll just have the opportunity to actually face that acutely, in the sense of consciously, and do something about it. And that is about living well, doing exercise, having friends, and, you know, don't let the bastards grind you down.
So the last one
That was it.
yeah.
It's-
So
it's-
sometimes fresh air and a walk outside
Doesn't
are not
cut it.
enough. Doesn't cut the mustard.
And that's right. Yeah.
One little question. Have we got any postcard or business card type publication that we put in the box and hand out when someone says, what's the shaking in the car? I've got Parkinson's. Hand over the card, which explains your
I think that's a very good idea. I mean, I think that's just a very good idea. I mean,
for people with Parkinson's, but our partners as well.
yeah. I mean, I think it must be really hard to be questioned all the time about things like that. Yeah. Actually, yeah. Well, I think that's something Braintree could look at.
There is a card, the Hi-Pi card, which we can help you fill out. So that's kind of an access card as well, so you can show it if you're needing quicker access to the toilet, or if queuing is an issue. So yeah, please do talk to us about that if you are wanting to look into it, but that absolutely is available.
I was thinking t-shirt, mate. Just say, yes, I don't feel like some of the time I've got these on the back, so you actually,
Wearing with pride.
Yeah.
There's another one for multiple sclerosis, which is, I don't just have one sclerosis, I've got lots of them.
Yeah.
But I mean, that goes back to my comment about how resilient people are and how you can use humour about those kind of things in a constructive but assertive way to make your point.
I think not being, when people have problems asking, it's not the trying to explain to them, it's just they kind of don't know what to say, starting that conversation.
Yeah,
Which is
absolutely. Yeah. Were there any more questions in the room or come round? Did anyone have anything?
Did you want this one? Oh, do I?
Yeah.
Oh, okay. I just wanted to say that when I had the first symptoms, I have a relative who had Huntington's disease, and I was really, really scared that I had that. So when I was diagnosed with Parkinson's, I was immensely relieved. And so that's come with me, and I do the best I can. But it was a way of helping me sort of think you're much better off than you could be.
Yeah. Thank you.
Yeah.
And I think Tegwyn really spoke to that actually we have a super resilient community. I was just telling him before this talk, I'm biased, but I love our community of people because I just think we do all support each other, and you're super resilient, and that strength that you have, but it doesn't mean that you can't ask for help and support where needed. So it's good to know that that is available to people should they need it, and keep that relationship up with your GP, super important. And if you don't have a relationship with them, then look for another GP.
That was what I was going to say, yeah.
Yeah. Any other questions at all?
Do we need a referral to see the
Referral process.
Yeah, your GP can refer it to us, yeah.
Yeah, so,
Yeah, GP can contact us, and then we'll see where we could. There are different. We have a broad service, and I'm only part of it. Part that's kept in the cellar.
okay.
Just like you, great.
So no more questions in the room? Oh, one more
What's
down
the
here.
waiting lists for the community referring to you?
Waiting list.
God. At the moment, we only have about 2 or 3 weeks. It fluctuates like everything else. We're a very small clinic, but we try to be responsive. So I don't, but that's what we see, 3 to 4 weeks. Okay. But talk to your GP, because the GP may not think may have a better idea about what we do. I, of course, think our service is the best in the world, but that is totally to do with my narcissism, not to do with anything else, or any objective measure. I just think it's brilliant.
Okay.
Thank you.
No more. Thank you very much.